Anatomy video number 3. Inguinal Triangle of Hasselbalch. I haven't heard or remembered that name yet. Okay, the boundaries of the Inguinal Triangle of Hasselbalch. Let's see what the picture says, where it is. Looks like it's right in here. The boundaries are rectus abdominis, inferior epigastric vessels, and inguinal ligament. The inguinal ligament is the infolding of the lower end of the aponeurosis of the external oblique muscle. Inguinal. It extends from the ASIS to the pubic tubercle. That's the inguinal ligament. The roof of the inguinal triangle is the skin and external oblique aponeurosis. The floor of the inguinal triangle is transversalis fascia. Direct hernias pass through Hasselbalch's triangle. Indirect hernias pass through the deep inguinal ring, which is a defect in the transversalis fascia. All right, let's look again. Here is the inguinal ligament, and there's our triangle, and that is the spermatic cord going through inguinal triangle. Next is the femoral triangle of Scarpa. Remember, the inguinal triangle was of Hasselbalch, and the femoral triangle is of Scarpa. The boundaries of the femoral triangle are the inguinal ligament, the medial borders of sartorius and adductor longus. The roof of the femoral triangle is the skin, superficial fascia, and fascia lata. The floor of the femoral triangle is iliopsoas, pectineus, and adductor longus. The contents of the femoral triangle are the femoral nerve, femoral artery, femoral vein, and femoral canal. The femoral artery, vein, and canal lie inside the femoral sheath, which is formed from fascia related to transversalis and iliacus muscles. That's in the femoral triangle. The femoral nerve lies outside of the sheath. Here's the femoral triangle. Here is the inguinal ligament. Here is sartorius, adductor longus, and pectineus. We've got the femoral nerve, artery, and vein. And remember that the femoral nerve lies outside of the femoral sheath. Turn the page. Anal triangle. The boundaries are the anterior border. They wrote this a little different. Are formed by the perineal membrane and two. So let's see. The anterior border of the anal triangle is formed by the perineal membrane, and two posterolateral borders are formed by the sacrotuberous ligaments and a line joining right and left ischial tuberosities. Oh, I see. Okay. So let's look at it. These are the isch tubes, or the line between the two isch tubes. So that's the anal triangle. All right. The floor of the anal triangle is the skin, and the contents include anal canal, ischioanal fossa, pudendal nerve, and internal pudendal artery and vein. Urogenital triangle. The boundaries. Anterior boundary is the pubic symphysis. The lateral boundary is inferior pubic rami and a line joining the right and left left ish tubes. All right. The floor of the urogenital triangle is the skin and superficial fascia in the perineum. The roof of the urogenital triangle is the deep perineal fascia. The contents, we have to do this by XX and XY. All right, for XY male, in the urogenital triangle, we have the bulb of the penis and associated muscles like ischiocavernosus and bulbospongiosis. Superficial transverse perineal muscles, deep perineal branches of the internal pudendal vessels and pudendal nerves. XX female is going to have this in the urogenital triangle. Clitoris, associated muscle, ischiocavernosus, bulb of the vestibule and associated muscle, bulbospongiosis, greater vestibular glands, superficial transverse perineal muscles, deep perineal branches of internal pudendal vessels and pudendal nerves. Let's take a look at it again. Here is that line between the two ish tubes, and then the pubic symphysis and the inferior pubic rami. So this section up here is urogenital triangle, and this section down here is the anal triangle. Okay. Page. Anatomical spaces. Thoracic outlet, really important for chiropractic, aka superior thoracic aperture. Did not know that. Okay. Boundaries of the thoracic outlet or superior thoracic aperture are the posterior section of the T1 vertebrae, first ribs for the lateral, and manubrium of the sternum for anterior. The roof of the thoracic outlet is the suprapleural membrane, also known as Simpson's fascia. Simpson's fascia extends from the tip of the TPC7 to the inner aspect of rib 1. The contents of the thoracic outlet. This is a big one. So, thoracic outlet includes trachea, esophagus, thoracic duct, brachiocephalic trunk, left common carotid, left subclavian arteries, right and left brachiocephalic veins, right and left vagus nerves, phrenic nerves, right and left sympathetic trunks, T1 brachial plexus, and sternohyoid, sternothyroid, and longus colli muscle. Let's take a look at the thoracic outlet. T1 vertebrae, first rib, manubrium, brachial plexus, subclavian arteries. It's just inferior to that. Good. All right. Axilla. Might not make it through this page by the 10-minute mark, so might have to go over on this one. The boundaries of the axilla or armpit are pec major and minor for the anterior boundary, subscapularis, teres major, lat dorsi for the posterior boundary of the axilla, upper four ribs, serratus anterior for the medial boundary of the axilla, and bicipital groove of the humerus for the lateral boundary of the axilla. The roof of the axilla is a triangular interval bounded by clavicle, first rib, scapula. Clavicle is the anterior, first rib is medial, scapula is posterior. The floor of the axilla is skin and superficial fascia. The contents of the axilla are axillary artery and branches, axillary vein, tributaries, cords of the brachial plexus, and 6 groups of lymph nodes. Anterior pectoral, posterior subscapular lymph, infraclavicular lymph, central lymph, apical lymph, and lateral lymph along the axillary vein. That's for the axilla. All right, quadrangular space. Boundaries. Teres minor is superior, teres major is inferior, long head of the triceps is medial, humerus is lateral. The contents of the quadrangular space are the axillary nerve and posterior circumflex humeral artery and vein. There's no roof and no floor for the quadrangular space. Triangular space. Boundaries. Teres minor for superior, teres major for inferior, long head of the triceps for lateral. The contents of the triangular space. Circumflex scapular branch of the subscapular artery. No roof, no floor for the triangular space. All right, that is it for this video, except I really want to show the illustration for the axillary space. There's the long head of the triceps. There's the quadrangular space. There's the little triangular space. That's teres minor, teres major. All right, underline.